My name's Dr. Jude Marshall. I'm a GP and the clinical lead for realistic medicine for NHS Greater Glasgow and Clyde. Realistic medicine is an approach to healthcare that is happening all over Scotland. It's been in place for around 10 years now. It focuses on 6 principles. These principles are shared decision making, having a personalised approach to care, reducing harm and waste, managing risks better, becoming innovators and improvers, and trying to tackle unwarranted variation in practice and outcomes. For patients, this means that our care should always be focused on them, it should be safe and effective, and they should be involved in decisions about their care. We're moving on to a new vision for realistic medicine called value-based health and care. This absolutely builds on those 6 principles I've already described, but shifts our focus to providing the outcomes and experiences that matter to those that we care for. Future care planning is a dynamic conversation that happens over the course of an illness or a condition and changes over time with people's wishes and their priorities. It's really important that as part of that conversation we hear about what's happening for you at the moment, what's happening with your condition and how is it being managed. We need to hear as part of that conversation what your values are, what your goals for your care are, and what priorities or choices would you make in the future. The way I look at it is that it's a conversation in the cold light of day to prevent a panic in a crisis. It's a conversation that happens with your healthcare team or your GP, for example, that then will be shared in a document to allow you to have some input into this, but to allow other colleagues in health and social care who may look after you to have a little bit of information about what's important to you, but to also know a little bit about your condition and how to manage it best for you. In the event of a crisis, it can be helpful to have that information for teams who may not know you as well and may not know as much as your usual team at managing your rare condition. These conversations can be recorded with your day-to-day team or with your GP and the team in the community to make sure you get the right care if a crisis occurs. If you don't have a future care plan, you think it would be helpful for you to have one, then please discuss this with the team that look after you usually, or speak to your GP or your community team and they will support you to complete one.